In 2017, the National Highway Traffic Safety Administration reported 37,461 fatal motor vehicle accidents occurring between 2015 and 2016 in the United States, 16,899 of those being between the ages of 16 and 24 years old. In this presentation, we will be reviewing the effectiveness of graduated driver licensing, an evidence-based program that was developed to help prevent motor vehicle accidents among novice teen drivers within their first years of receiving licensure. According to an article published in the Accident Analysis and Prevention Journal, the crash risk for 16-year-old drivers is approximately 9 times greater than for drivers ages 25 to 49 years old. Overall, 36% of teen deaths are caused by motor vehicle accidents. Currently, all United States have adopted graduated driver's licensing laws, and their individual level of programming varies, depending on each state's policies. As we assess the effectiveness of this program, we will also consider the factors that might enhance and hinder its success as it becomes more widely used throughout different locations worldwide. The Graduated Driver Licensing Program targets 16 to 17-year-old drivers who are new to roads and are most at risk for being in an accident. The GDL laws divide the process of earning one's driver's license into 3 distinct phases. The initial phase requires the teen to drive with a licensed driver over the age of 21 for a set period of time, such as 6 months, or after driving for a set number of hours. The intermediate phase includes driving without supervision in conditions that are less risky, such as during the day and without any other passengers in the car. The third and final phase is driving freely with no restrictions. One study published in the Journal of Accident Analysis and Prevention highlights the implementation of the GDL laws in 2003 in upstate New York, where the rate of injury was 31% less after the graduated driver licensing laws had been implemented. The overall impact was not as effective for 17-year-olds as it was for 16-year-olds. This study determined that the biggest factor to decrease the likelihood for motor vehicle accidents among teen drivers was a delay in licensure until the drivers were able to cognitively develop for an additional year to the age of 17. Similarly, a study in Massachusetts required a 2-hour driver's education course for parents, an education course for student drivers, fines for nighttime driving violations, an increased number of supervised driving hours, and a ban on mobile phone use while driving. The results showed an improvement from 14 fatal motor vehicle accidents to 8.6 after the GDL laws were implemented. Also hopeful was the data that stated a decrease in motor vehicle deaths in New York jumped from 16.1 before the GDL laws had been implemented to 9.5 deaths after GDL was in place. There are many factors that will impact a novice teen's driving ability, all of which will play a role in shaping how they will operate a motor vehicle throughout their lives. As we ask the question of what makes this program effective, we must also consider factors that impinge on its success. Some of the factors that contribute to its effectiveness include parent involvement in the implementation and follow-through of the GDL laws. It's been proven that less risky driving and motor vehicle accidents occur when parents set limits for their children. Other involvement that parents have include the required supervision of driving during the initial learning permit phase, providing a vehicle to drive in, and identifying when their child is ready and allowed to take their licensure exam. Another entity involved in the effectiveness of GDL laws is law enforcement itself. In Massachusetts, novice teens are not able to use their cell phones on the road and will receive an increased fine if police identify them as violating cell phone bans. Teens involved in a traffic violation that takes place during restricted nighttime hours have to face a monetary penalty. GDL laws restrictions are proven to be incentive for parents to set more limits with their children in an effort to keep them out of trouble. Other impactful factors include the gas prices in a given area and its likelihood to result in less miles driven by the teen. According to a study in the Journal of Applied Economics, a 10% increase in the gasoline prices reduced driver fatalities by 6.2% for 15 to 17-year-olds and 3.2% for 18 to 20-year-olds. The use of cell phones while driving is another major hazard for all drivers, especially younger ones with limited experience. 11% of fatal crashes between the ages of 15 and 19 are due to distracted driving. 52% of 16 to 17-year-old drivers reported using their cell phones while driving, and 48% of teens reported being in a car when the driver was texting. Wearing seatbelts is another preventative measure that could drastically reduce one's risk of being injured or dying at the time of a crash. Seatbelts reduce the risk of death or severe injuries by 50% for both drivers and passengers in the cars that are involved in accidents. The success of the GDL program is largely dependent on the motivation of a teen to abide by the laws that are being set into place. While the graduated driver's licensing program actively engages the teens in understanding driving risks, they still have to make the decision to behave in accordance with their training. For example, many teen drivers acknowledge the risk of drinking and driving, not wearing a seatbelt, and using a cell phone while driving. However, that did not stop most teens from continuing to engage in those things. Understanding teen perspectives is critical in addressing how to usurp unfavorable driving behaviors. Student drivers need to be motivated to follow through with restrictions put into place by the GDL laws. Using an ecological model to understand how a teen's community, relationships, local policies, and institutional factors will influence the interpersonal factors that lead to wiser decision-making as new drivers will prompt positive behavioral changes and ultimately result in an environment conducive to safer teen drivers. Graduated driver licensing was first designed in the 1970s by Dr. Patricia Waller as a result of 2 studies she conducted regarding driver safety in North Carolina. The findings of these studies presented 3 major themes, including most crashes involving young drivers, the tendency for crashes to occur between midnight and 6 a.m., and the negative impact that passengers have when they are in the car of a new teen driver. Dr. Waller used this data to create programming and presented it worldwide. New Zealand was the first to adopt the graduated licensing system in 1987, and though other states were interested in the concept, controversies over lowering the driving age and the cost and resources of executing it outweighed the strong data supporting it. A turning point for more serious consideration of GDL was a tragic car crash in Michigan in close proximity to a legislator's home involving young teen victims. Dr. Waller met with legislators to discuss GDL and ways to introduce it to their own states. After a few negotiations, Michigan was the first U.S. state to utilize a system that was created over a decade earlier. Since this initial integration of GDL in a U.S. state, all of the states have adopted the system to varying degrees. There's no federal law that mandates the implementation of graduated driver licensing, meaning it is up to state legislation to determine the degree to which teen driver provisions should be followed. External stakeholders that support the framework for successful implementation of GDL systems include the media. Media campaigns address teen driver safety by covering teen driver deaths to gain awareness of the issue's severity. This can be an effective way to gain the public's attention as well as a platform for officials to demonstrate a connection to their political agendas. Law enforcement and the judiciary system are also very important external stakeholders in the effective execution of a GDL program. Police officers must remain apprised of their state's driving laws in order to react accordingly if a teen is driving with too many passengers or after their permitted daily time frame. Failure to comply with GDL restrictions requires attention from law enforcement and potentially punitive measures if the offender has compromised state laws. Agencies issuing driver's licensing must also be aware of the steps that are required for an individual to graduate through the 3-step process. Having a working knowledge of the criteria that a teen must meet to earn one's licensure will allow an agency worker to guide teens through the process. Lastly, parents and drivers themselves are stakeholders and key players in the program, as they may need to fund some of the educational aspects of GDL on their own, and their involvement is imperative in sustaining its efforts. Another concern for the implementation of GDL is the funding involved in starting up and maintaining systems within each state. Although various organizations provide grants in an attempt to fund driving risk prevention, there are still costs associated with carrying out a GDL program. Some of these costs might include hiring driver educators, paying for and maintaining a host building, advertising, insurance, the purchase and maintenance of student driver automobiles, and program materials. These costs can add up, yet the General Accounting Office reports and testimony put all of this expense into perspective by stating, the Federal Highway Administration estimates the average societal cost of a motor vehicle fatality to be around $3 million. This data shared that costs associated with accident prevention are a bit more palatable when compared to the cost of a fatality. The National Highway Traffic Safety Administration, an organization within the Department of Transportation, encourages states to support driver safety programs such as GDL by carrying out research to highlight teen driver safety issues. Other organizations that use research to communicate the dire need for structured GDL programming are listed on this slide. The research is presented to legislators who can choose to advocate for state bills to address common teen driving risk factors. The IIHS ranks each state's licensing programs based on the chosen amount of GDL laws and provisions that it requires its teen drivers to carry out before earning their license. As the graduated driver licensing program began to gain acceptance among the states, it was also met with opposition. During initial discussions of GDL, legislators felt that the amount of parent involvement required for a teen's completion of the program was not realistic. Legislators were worried that this new mandate could negatively impact votes from parents of aspiring teen drivers, ultimately influencing their political popularity. Despite their apprehension, parent supervision hours were added as a standard requirement for GDL. Contrary to the belief of the legislators, parents generally stated that they were pleased about their involvement in the process. A concern that parents did have, however, was regarding the regulation of passengers a teen driver could have in their vehicle. Some parents viewed their child's newly obtained license as an opportunity to transport other siblings to and from activities. Having the passenger restriction in place quickly disabled their teen driver from being their sibling's personal chauffeur. This concern did not halt the GDL requirement of limited passengers in a vehicle. Others in opposition of GDL requirement were the teens themselves. A study reported in USA Today shared that the economy often plays a role in a teen's desire to drive. As gas prices increase, teens will struggle with being able to afford the fuel and maintenance of their vehicle. Some teens also feel that the process of obtaining a driver's license before the age of 18 is arduous, and they would rather wait until after they turn 18 to get behind the wheel for the first time. Much debate has occurred about this issue because although 18 years old is believed to be more developmentally mature than 16 to 18-year-olds, their learning would not take place under the supervision and structure of their parents. For this reason, the Governors Association made a recommendation that the states extend the graduated driver's license restrictions to 21 years old to avoid teens from waiting until their 18th birthday to get behind the wheel. At this point, only New Jersey has extended their GDL age from 18 to 20 years old. In order to account for all teen drivers who wish to obtain their license, it is important for state officials to think about the social and cultural barriers that affect potentially challenging obstacles of learning a new skill, such as driving. An example of this is the requirement for teens to have a parental figure to accompany them for a certain time frame in order to advance to the next level of licensure. Strained family dynamics can complicate this obligation if parents have minimal involvement in a child's life or are not present at all. For this reason, it is important to not disadvantage teens who are without family support and feel challenged by this mandate. A suggestion made by Patricia Waller was to utilize individuals from civic groups such as Big Brother, Big Sister to play a role as a stand-in guardian to teens who do not have actively engaged adults in their lives. Regardless of family involvement, it also cannot be assumed that every household contains an adult who is currently licensed. Engaging community centers that offer supervisory services is an important step in being able to provide the appropriate means to teens that do not have those resources available. Households with lower incomes or that are located in more urban environments and currently rely on public transportation may not be in possession of a vehicle. Not having a vehicle to practice with would slow down the process of obtaining practice driving hours to advance to their next level of licensure. Other factors that contribute to equal opportunities for less licensing of teens are cultural barriers. Factors that may hinder the ability for immigrant teens to easily learn how to drive in the United States include physical changes, from the layout of roadways and signage that they are used to language barriers. These challenges are important to consider for providing an equal learning opportunity to all cultures. Some of the ways that GDL has addressed these issues has been utilizing media that targets these populations to enhance their understanding of the new cultural norms. For example, sharing seatbelt regulations on foreign language radio, television stations, and frequently visited websites will allow the teen to learn about the driving guidelines in an easier way. Building relationships with community organizations that have already built a connection with minority teens can be a bridge to those individuals who need additional support to understand U.S. road rules. The turning point for this program was an increased need for GDL that gained attention in the media and required action from local legislators. Having the data to support a need for more teen driving provisions, as well as research to prove the effectiveness of GDL, provides the necessary substance to make changes to current laws and revisit existing licensing laws in the states. Data is essential in comparing statistics with other states who may consider ways to decrease their own fatal motor vehicle crash rates among the novice drivers in their states. In order for the new laws to be effective, Buy-in is necessary from local communities adopting a new system. Parents of teen drivers have positively responded to the program thus far, as well as driver educators who are invested in providing the best education for their students. When Patricia Waller began working on GDL, she first considered how the history of driver education had evolved. In her research, she discovered the necessity of behind-the-wheel application through distributed learning. The concept that practicing a technique over time will lead to better performance rather than trying to master it all at once. Another concept that Waller employed was beginning simple and working toward more complex instruction. In previous years, programs would allow drivers to enter the roadways directly after passing a written test. The graduated driver's licensing program forces a student to continue practicing under supervision and with limited safety risks to establish a greater level of comfort. Waller utilized tools within the program that would require a driver to spend more time perfecting the newly learned skills, applying them in a more controlled way and in less risky conditions. These reasons, along with other provisions that research has proven to reduce driving risks, all contribute to a better outcome of less injury or death among teen drivers. As we identified earlier, a need is only met with action when certain events align in order to allow next steps to take place. An example of this might be a politician's desire to improve driver safety for new teen drivers, but remains inactive in executing a plan to reduce teen driver deaths. This could be due to limited funds available to successfully support innovative education, or the belief that voters will oppose additional limitations to licensure. Marketing the program can be done through many platforms, such as media outlets that educate the public about the need for change in teen driver education. Engaging local figureheads who have a connection with the teen population to share the importance of GDL programming may be effective in ensuring that the teens are taking their education seriously. Schools may host parent and teen nights to celebrate the upcoming driver licensing endeavor while educating parents and teens of the importance of driver safety and sharing data that proves state driving provisions lead to positive results. This venue could also offer strategies for working together as a family and being as transparent as possible. Community buy-in should expand beyond the immediate families and teens themselves, however. Having transportation available during restricted driving hours, as well as scheduling events during acceptable hours of operation, can make following rules easier. Bridging education between driver education programs and school health programs can target issues such as substance abuse, appropriate driving behavior, and peer pressure to provide teens with the tools that they need to be proactive in driving safely once they earn their license. Levels vary to which each state follow the systems, depending on the state's policies, funding, and legislation. This means that the scalability of GDL can be as basic as 3-phase licensing processes or as enhanced as the 3-phase program with many provisions. Limited research is available at this time to determine exactly which provisions are most effective. However, it is clear that more risk-reducing restrictions result in less car crash fatalities among teens. Giving each state the flexibility to conform to GDL to the degree that they are most comfortable can be considered another reason why it's been so widely accepted among the states. The Insurance Institute for Highway Safety rates the quality of each state's GDL implementation, which can be useful when carrying out research to comparatively assess the effectiveness of the program within the U.S. At this point in time, each U.S. state has adopted graduated driver licensing and with favorable results. In a study to evaluate the teen driver fatalities from 1994 to 2004, the National Traffic Highway Safety Administration identified an 11% decrease among teen drivers who had been enrolled in a graduated driver's licensing program. As seen in this graph, a significant decline in teen driver deaths has been tracked from 2000 to 2009, and with more success in states that have more restrictions. By following an ecological model to implement GDL, local legislators, driver educators, parents, and invested organizations can come together to ensure that the appropriate infrastructure and funding is in place to effectively roll out a licensing system that strives to eliminate teen driving fatalities. As research continues to evaluate successful outcomes of GDL systems, it will be important to continuously consider the outlying issues that may complicate a desirable outcome for students hoping to achieve licensure. Some of the issues discussed in this presentation include cultural challenges, students with complex family dynamics, insufficient funds for enrolling in a program, legislative agendas, and the many driving risks being evaluated constantly by public health officials. As new technology becomes available to teens, new threats to novice driving may add challenges that public health officials will need to stay ahead of. Partnerships with technology companies, media outlets, medical professionals, and school systems can help to educate teens about these dangers while working on external safeguards to making the roadways safe for all who drive on them. Since the 1970s, GDL has become widely accepted as a standard approach to teaching young teens how to safely operate vehicles. With the ability to continuously assess and improve driver education, and with growing support for stricter enforcement among novice drivers, envisioning a world with less teen driver crash victims is becoming a hopeful reality that appears more achievable than ever with the continued integration of graduated driver licensing.